What we're going to use is the cloth of a t-shirt, or you can use a towel because it grips. You can use it to grip. And then one hand either side, does not matter how you place the hands, whether you go in the right hand leads or the left hand. I tend to vary it. So I'm going to get my patient to take a breath in, please. And then they breathe out. So my hands are wider, this is more ribs. So I'm going to rotate and slowly just start to spring the ribs. This is almost like an assessment into a treatment because it almost like tells you what side you feel is stiff. Take a breath in again. Breathe out. So I'm going to rotate and then spring down through the ribs. If I change my hand position, breathe in again. And then breathe out. I can rotate. And I'm going to spring. The difference between a mobilization and a manipulation is just the speed of execution here. And obviously it's more of a thrusting technique. But I'm very close to thrust on what you've just seen. Let's just do a little thrust technique here. Take a breath. And then breathe out. Breathe out. You lock. And then the thrust would be down. And breathe in again. And then breathe out. So we rotate. We lock. And then the thrust is simply down. And then sometimes you can hear a cavitation. Once more, breathe in. There's a little bit of stiffness on up his top right. And breathe out. And lock. And then the thrust is more down. Good. Now that's one technique for the rib. You can also use his pelvis. Hand onto the ASIS. Be careful where we are here. So we're going to slowly pull his body towards me. And then we're going to come onto the lower ribs. And I would normally say to my patient, take a breath in. And as he breathes out, I will pull, I will lock. And I can mobilize here. So I can mobilize the ribs. Take a breath in, breathe out, and I can mobilize. So I can just lock and mobilize here. And sometimes it's probably more comfortable for the patient if you mobilize. Because if you thrust in every time, he can be a bit irritated. Take a breath in again, and breathe out. If you wanted to thrust, you can lock, and a thrust is simply towards the opposite shoulder. Okay, so you're going to go towards the axilla on the opposite side. Breathe in again. And as you breathe out, you lock, tension, thrust. And then that would be an alternative way of trying to cavitate the joints. And one more, which I particularly like, is almost using the two hands in a similar sort of fashion. And then let's say, for instance, we're on T7, so we're going to come to T6. Using the sort of, well, the pisiform area, we almost come in like this, and we can put the fingers together and we can lock. Take a small breath in, please. And as you breathe out, we lock, and the thrust is down towards the couch. Take a breath in again, and breathe out, and lock, and the thrust is towards the couch. And again, you might get a cavitation depending whether the rib needs to be released or not. And there we have two. This is not so much a positional manipulation. What that means is, when I say the word SI joint, I'm going to just reverse those words and call it the IS joint, so the ilium on the ilium on the sacrum here. So I'm going to move this bone on this bone. So it's not moving the sacrum on the ilium, it's moving the ilium on the sacrum. And most of the time, this innominate, which is the ilium and the ischium and the pubis, is conjoined to one bone, but we call the innominate. So I will try to mobilize or manipulate the innominate on the sacrum. And typically it tends to go forward, so I would move it back. If it's gone back, I would move it forward, but this one's more of a gap-in technique. Sometimes this area gets a little bit stiff, so I'm going to place my hand on top and use it, rather than pushing it forwards or backwards, just literally just thrust, just to gap it. And sometimes that works to allow the joint to move a little freer. Now I've got a patient in front of me where we're going to utilize the technique. So Dave, can you have a lie on your side, please, towards me? Now, what we're going to get the patient to do is come towards me a little bit, like that. And I tend to, for this technique, because there are many, I tend to bring the knee up and then place that into the crease of the knee. But I'm going to use my leg because I want to bring the innominate fully into posterior motion just to increase the tension here. From here, I'm going to place his hand to stabilize. And then I'm going to feel the L5 and onto the S1, and I'm going to fully rotate him down to the level, and then that locks the L5 onto the S1, because I only want to move this bit here. This hand can go there, his head can be in this position, and this arm can just relax here. Now, the couch has to be a little lower rather than higher, and a lot of osteopaths and chiropractors will use their body weight to try to go through the thrust. If the patient is flexible enough, you should be able to roll the patient. So I tend to roll. So the key ones on manip is I tend to roll as if I'm going to fall in this position here. I have to stabilize with my opposite hand, but there's no thrust in this hand. There's the PSIS. And what I'm going to try to do is, rather than going that way or this way, is just hand on. My arm is over. Sometimes I'll use my body weight, so I'm going to roll. Take a small breath in, please, Dave. And as he breathes out, I'm going to roll, lock, thrust. And then we have a cavitation of the ilium on the sacrum. Now, what we're going to do is, if we roll on the other side, let me just check the other side. And rest your head back, please. So we'll do the similar sort of technique. So I'm going to bring his top leg, bend up one leg a little bit. So I'm going to use my leg. In fact, I'm going to bring him a little bit towards me from here. I'm going to bring this one up just to increase the tension here. And again, hand to stabilize. Palpate L5 and S1. And I'm going to slowly rotate him down to the area. Hand there, and his neck is fine. Arm just to relax. Find the PSIS again. So I'm going to stabilize. I'm going to roll as if a patient's going to fall in this position with the knee up. Take a small breath in, please. And as he breathes out, the thrust is going to be down. Okay, and then we had a little cavitation of the ilium on the sacrum. Have a line in your back, please. I hope you liked the video.